Hello, everyone. This is Dr. Vargas. I am preparing this video for those nursing students who are having trouble understanding the cardiovascular disorders and its questions related to pathopharmacology or pathophysiology, or even for the APR and FNP board exams. So these slides will have a lot of cardiovascular disorders that you will see. Some of the common topics that I have seen in the previous years of teaching pathophysiology and APRN courses. So here we go. Here's a reassuring words from Isaiah 40, 30 to 31. For those who need some extra spiritual encouragement, I have added these slides to just keep them going. Do not ever give up on your ability to perform beautifully as a nurse or a nurse practitioner. So make sure when you learn cardiovascular system or any system, pathophysiology or pharmacology or any clinical conditions, you want to know the basic anatomy and physiology. For heart, you want to know the electrical activity, the anatomy of the heart, and how does the sympathetic and parasympathetic nervous system work in each of those activities. So keep in mind, the sympathetic nervous system increases your cardiac heart rate, and also it has effect on the conduction process. The parasympathetic does the opposite of what the sympathetic does, and that is often seen on those clinical exam questions where vasodilation is brought up with the case scenario with hypertension or myocardial infarction, and that is related to conduction-related questions, so this is important for you to know. And here are 4 determinants that you have to know. These are basics from the RN level, but this is going to be used in most of these conduction-related disorders. So we're looking at cardiac alterations and its pathophysiology and the medications that we use in clinical cardiac conditions. So preload, afterload, myocardial contractility, and heart rate. These are the 4 determinants that cardiac health is related to. So the preload is just listed here. Like I said in my previous videos, I am not going to read off these slides because for a person to understand the pathophysiology, you have to sit down, you have to write it down, you have to look at the slides, you have to understand. So there's no point of reading up the slides because this is not something you can learn when you drive to work or when you are cooking. This is something that you have to put that 1 hour of your time to sit down and study this. Okay, so that's why I'm not reading off the slides. I'm pointing out the important things that you have to know for these exams. Preload is listed here, the 3 main points. And then we have afterload. And what afterload is depending on, it's the aortic pressure. A lot of students miss that with the ventricular question answer choices. And look at the medications that is used that in order to reduce the afterload or the aortic pressure. And there are the cardiac injuries, you know, how is the case presented? For example, CHF patient or hypertensive patient. What are the type of injuries that you will see related to preload or afterload, okay, or heart attack even. So the mechanism of preload and afterload is detailed in this slide. For any reason, if you cannot follow these slides, if you need a copy of the PowerPoint, please send me an email. The email is listed on the slide number 1, and I'll be happy to send it to you for your learning purpose. And here we go. And there's a sample question that I have added here. This is taken from a book that was given to me to teach students. So that book information is also on these slides, okay? So Frank-Starling law or Frank-Starling mechanism is seen in the patho questions. So you have to know what that has to do with the preload or afterload, okay? So it increases the filling pressure of the right heart. So if you have a patient with the right heart and left heart failure, this question is related to a lot of times with effusion, cardiac output, or congestive heart failure related questions. So this is important. And then we have the main players that creates this vicious cycle of the afterload and the preload, and which also decreases in the contractility in heart failure patients. So the first one that you will see these catecholamines terms on the questions. So like I said earlier, sympathetic nervous system activates, and then it compensates for a poor cardiac output by increasing your heart rate, and also increases the peripheral vascular resistance. There are numerous effects that catecholamine causes on your heart. Myocardium is one of the structure, and directly it causes direct toxicity to the myocytes. And the pathological process is induction of myocyte apoptosis. We learned the apoptosis in cell biology, and also it causes remodeling of the myocardium. And a lot of times this is related to autoimmune effects of the heart muscles. So this is a great slide for understanding the mechanism. And then we have RAS, renin-angiotensin-aldosterone system. I have detailed that in slide number 2. So these are the two main players you have to know. Atrial fibrillation is a condition that you will see a lot of times on these questions. Digoxin you'll see on pharmacology questions. So I have the toxicity listed here, what causes the toxicity and what the pathophysiology, and here's the sample question on EKG variation. DVT is another one you will see a lot. Common exam scenarios will be childbearing women or birth control pills. So know this slide, okay? And why is the D dimer is increased? Because of the high thrombin production. A lot of students miss that. And then the pathophysiology is listed here. And Varco's triad is also seen on these questions. So it includes 3 different areas. One is injury to the endothelium. The second one is abnormal blood flow, which is also causes venous stasis and hypercoagulable state. A lot of questions come with this because they put this factor V laden. You know, we have the genetic conditions related to the abnormal factors in the blood. When you learn hematology oncology, this is also listed. So this is to distract students, but hypercoagulable is the answer they're looking for. So I put those examples where they use in the clinical questions. Continuing on the DVT, estrogen comes on the boards with DVT connected, and here's the pathological response to that. And know these highlighted pathological process, okay? Thrombosis, fibrinolysis, and vein thrombosis, thrombus propagation, all of these comes. This was seen lately in one of the APRN board exams, so I have added that for students to know how they are looking for those specific terms. This highlighted phlegmaxia ceruleae dolens was also seen lately. So this is all related to DVT, one of the signs and symptoms in mild, moderate, and severe cases. So you have to understand this also for the clinical practice. And this is an article that I have taken most of this information from. So you will know the detailed descriptions of all these. Cardiac alterations by peripheral vascular disease. So DVT is one of them, and now we have peripheral arterial disease. Varicose vein, chronic venous sufficiency, these two comes on board exams very often. So study this slide. And then there are 2 questions related to that. The highlighted ones are the answers. A lot of students miss that number, okay? So please pay attention. This is important for your clinical practice also. And this one is another one, easy missed. Everybody pick ultrasound over venogram. So they're looking for a gold standard to diagnose the venous thromboembolism. So venogram or venography is the one that we use, okay? And then we have congenital heart disease. All of these 2 different murmurs, you have to know, you had to memorize them. How is it and where do you palpate as a clinician? And these also, when I say know these, means I have seen this in the questions before. Study the slides regarding coarctation of the aorta. So a lot of times the students miss that because they think hypertension is an adult disease. It can happen in pediatrics. So coarctation of the aorta is a secondary cause of hypertension in the kids. And here's the pathological reason for that. Study this. Cardiomyopathy. Lately, you will see a lot of people, here on the news that younger generation are, heart attack while exercising, or, these are often not diagnosed until they become really, really symptomatic or they even die. A lot of times we miss this. So if a family history of dilated cardiomyopathy or any cardiomyopathy in your family history, it puts the younger generation at higher risk. So it's important to get a thorough history of patients with heart disease. I have several family friends that was diagnosed very late when they become really symptomatic. And they often call it as a silent heart attack, ended up with a cardiomyopathy diagnosis. So the three types of cardiomyopathy is often seen. I have listed the characteristics, the signs and symptoms, the diseases that is associated with it, and the pathophysiology. So study this slide, okay? There are two questions that I've seen this before. So highlighted, the red highlights are the answers for these two questions. And then we have cardiac alterations with hypertension that causes target organ disease. So target organ disease is also called hypertensive emergency when it affects all of your kidneys, your lungs, your heart, and also central nervous system. It's an overactivity of the sympathetic nervous system causing all of these symptoms. And it also causes electrolyte imbalance. It causes tissue ischemia with kidney disease, and then vasoconstriction. That's the key word here. And tubular ischemia, you will see that on the exams. Pathophysiology is described here. Cardiac alteration by heart valve dysfunction. When we do 2D echocardiogram, you'll see the heart valvular disorders, right? So know these basics. And here's the 4 phases of cardiac cycle. This is the basic information, but I'm adding it here so you will understand how it alters with cardiac valvular disorders. So mitral stenosis, mitral regurgitation, you will see that on board's questions and also Patho and Pharm questions. So study the slide for valvular disorders. There are 2 sample questions. There's one that is related to that, also has initial stages of shock. I added this from another video. Because of the heart rate variation, I have added that. The student, they mislead students with other conditions like burns and all, with cardiac diseases, and the burns is the right answer for hypovolemic shock. So you have to pay attention to the question. The nurse recognizes patient, greatest risk, hypovolemic shock. It's not a myopathy because we just learned cardiomyopathy. It's pericarditis, sepsis, burns is the right choice. And atherosclerosis, you'll see a lot of times with cholesterol levels added. Smoking is often seen related to atherosclerosis questions. So this is important. By aneurysms. Aneurysms are often seen when they do CT scan of the abdomen, CT scan of the chest. So there are 2 kinds, true and false. You will see this on questions. The pathophysiology is listed here, remodeling and weakening of the vessel wall. That's the choices that is often given. There are 2 questions related to atherosclerosis, and here's a slide for myocardial infarction. Study the pathophysiology, the modifying and modifiable and non-modifiable factors are listed here. A lot of students miss those, so memorize this and know this for clinical practice. What happens after a heart attack? You have to know the pathophysiology of this. The first one, often students does not know what that is. So questions are like post-cardiac patient, they put a scenario and give you like answer choices with other stuff, but the collagen matrix is deposited and is initially weak, becomes mushy and vulnerable for re-injury. So they are at high risk for recurrent myocardial infarction. This collagen turnover causes breakdown and synthesis during this myocardial infarction process. It usually happens early after the first one. And then, our heart tried to preserve, the extracellular matrix and collagen deposition at the site of myocyte necrosis, which is the dead tissue of the myocardium, which is, it is important for, to create a structural integrity of the already necrotized or infarcted heart. So it's an important point for students to understand what happens after a patient had a heart attack and what goes through their cardiac myocytes. And the time frame is also very important. The recovery period is 10 to 14 days after the initial attack. People will become more active. At that time, the stress level is lesser. Remember, we talked about renin-angiotensin, and this is a slide that gives you every details of the renin-angiotensin mechanism. You have to know this for kidney diseases, cardiovascular diseases. A lot of medications are used to block renin-angiotensin mechanism. You have to know that with hypertension cases, tension cases, and also heart failure. So study this slide for angiotensin 2 and RAS. So this one is another continuation of the RAS. It gives you what that means, renin-angiotensin, and what it's composed of, how it affects the angiotensin 2 and aldosterone. And arginine vasopressin is recently seen on one of the questions, which is related to a diuretic use for patients with hypertension, and that the answer choices was the side effects. So hyponatremia and heart failure patients, you will be careful giving that because it causes increase in edema. Here's a sample question on the heart attack. Congestive heart failure is very important. So I have added several slides to explain the definition, the signs and symptoms, the pathophysiology. Here's 2 sample questions. The right heart, left heart failure, you have to know this. The left ventricular ejection fraction of a normal heart versus the congestive heart failure is listed here, what the pathophysiological process with LVDEF in left ventricular heart and right ventricular heart failure patients. This is a detailed slide continuing on the diastolic heart failure. So it's diastolic is a right heart failure. Systolic is a left heart failure. So you look at the left heart related signs and symptoms when it comes to less than 50 or 40 to 50% of patients, you are looking for left heart failure symptoms. The right heart failure, you'll look for the pulmonary symptoms like patients will have hypertrophy of the right ventricle. It increases your workload. It causes both diastolic and systolic deterioration. And patients will have higher risk for COPDers or cystic fibrosis patients. They are usually seen as a pulmonary hypertension diagnosis. I had several patients with pulmonary hypertension diagnosis, and they have this diffuse signs and symptoms. It's hard to say if they are going through right heart or left heart failure. Here's the different signs and symptoms that you will see on both sides. The murmurs are described in the initial slides. There's increased heart rate, tachycardia. They will have a JVD extension on the right heart. They have edema. Anasarca is often seen. Hepatomegaly is often seen as an answer choices. And here on the left heart failure, the heart sounds S3 and S4 very much seen on the APRN board exams. The pathophysiology of left and right heart failure indicates all these signs and symptoms. So if you know the patho, you will be able to answer these signs and symptoms or differentiating factors of both right and left heart failure. Nocturia or nocturnal dyspnea, okay, PND is left heart related. And then we have the cardiac markers, natriuretic peptides, ANP, BNP, and CNP. You've probably seen a lot of BNPs in the clinical setting, but we have a CNP also. It's more found in the central nervous system and peripheral tissues. Both ANP and BNP has vasodilation characteristics. It increases the natriuresis, diuresis, and anti-fibrotic, anti-hypertrophic effects of the heart. It's one of the cardiac markers we use to evaluate congestive heart failure. So here's the sample questions related to that. Cardiac markers continued on cardiac troponin. A lot of times students miss this, so make sure you know this. The biomarkers released by the myocardial cells are the CPK-MB, CPK and CKMB, and LDH. So sample question. These 3 diagnoses of cardiac coronary syndrome. and NSTEMI, and unstable angina. You have to know the mechanism of these. And then here's a sample question. Pericarditis is seen also on boards. The sequelae of pericarditis is the one that students miss. So study that and the pathophysiology, of course. Here's two sample questions on the acute pericarditis. Once again, I'm going to reinforce you that you have to look for in the exam settings, no matter which exam you're taking, look for the keywords like except, true or false, did not, may not, select all that, apply, all of the above. These are the keywords they use to distract students from picking right choices. You know the answers, you know the content, you know the materials. You miss this by not breaking down the question looking for these key points. So hopefully this will help you, okay? And again, stay positive and make sure that you submit and you surrender yourself in the Almighty, and the God is going to help you. He is our refuge and strength. Good luck and have a blessed time reviewing the slides, and I hope you're learning something because of this. I have 32 years of experience in teaching nurses and nurse practitioners, so I wanted to share this with all of you. Have a blessed time listening and learning. Thank you.